This isn't for your erections, it's for your arteries. Penile health is an area that's very underestimated by most men. Having good erections, you should know by now, is not a luxury, and it should be within everyone's reach at any age. Now let me ask you a question. Why are so many healthy men, even many professionals, taking low doses of this? Yes, I'm talking about this orange pill called Tadalafil. And it's a long-acting phosphodiesterase type 5 inhibitor. You may know it or you may not, but this video will definitely make an impression on you. I'm Dr. Borja Bandera, a physician specializing in endocrinology and nutrition. In today's video, we'll explain how this category of drugs brings us broad benefits beyond just sexual health. We'll look into the pros, but also the cons of their use. If you're concerned about your health and longevity beyond just your erections, stay tuned. First, what are PD5 or phosphodiesterase 5 inhibitors? I'm going to explain it in a very simple way. PD5 is an enzyme. When this enzyme is inhibited, the bioavailability of nitric oxide in your arteries increases significantly. NO, or nitric oxide, is the main vasodilator molecule in your body. It opens up the arteries and allows more blood to flow through. The key is that this is not a local effect. It doesn't just happen in the arteries, it also happens in the arteries of the penis, which is why erections improve. They also cause vasodilation in the smooth muscle of the bladder, prostate, and urethra. And that's where the great potential benefit lies, in all the systemic vessels. This is because PDE5 is abundantly expressed in the vessels of your lungs, your heart, your muscles, and the rest of your tissues. Now, I'm sure you're wondering about the differences between Tadalafil, which I just showed you, and the old Sildenafil. Yes, the little blue pill. Both share the same mechanism of action that I explained to you, but they differ in their chemical structure, pharmacokinetics, and selectivity for isoenzymes. In practice, what you need to know is that Tadalafil lasts longer. It has an effect that usually lasts up to 36 hours, while sildenafil has an average effect of 4 to 6 hours. Both require sexual stimulation for an erection to start and be maintained. That is, it doesn't produce an erection just by taking it. Now let's get into the advantages of this molecule. What else is there beyond erections? What can its long-term use do for you? Well, look, the most powerful and truly novel thing about this video is that it reduces cardiovascular risk. Long-term chronic treatment with Tadalafil, at doses we'll discuss at the end of the video, improves the health of your blood vessels, and there is enough evidence to state that it reduces the risk of myocardial infarction, heart failure, and cardiovascular mortality. In this sense, although it's not their usual indication, we should stop thinking of these drugs only as medications for erection and start labeling them more as cardioprotective agents. It's something similar to what happened with GLP-1 regarding metabolism in type 2 diabetes. Initially, that was their primary indication, but later their uses were expanded to include cardiovascular protection, kidney protection, and so on. Well, this gives the drug class a much broader scope because, as I said, these aren't drugs for the penis, they're drugs for your arteries, and you have arteries throughout your entire body. But if you're someone who wakes up several times at night to urinate, you'll also be interested to know that it reduces the number of times you go to the bathroom at night. If you lose quality and quantity of sleep, something that happens to many men, because you get up to urinate at night, it's likely that you're experiencing lower urinary tract symptoms due to benign enlargement of the prostate. Well, 5 milligrams a day of Tadalafil improves these symptoms, not just erectile dysfunction, with an average reduction of 5.6 points on a scale that measures these symptoms when compared to placebo. In addition, this is an approved indication. This indication is indeed approved. It also improves Raynaud's phenomenon. Raynaud's phenomenon is an exaggerated response of your sympathetic nervous system and vascular smooth muscle to stimuli such as cold or emotional stress. Basically, what happens is that the blood vessels in these people's extremities, usually in the hands and feet, go into a paroxysmal vasospasm. That causes blood flow to drop sharply for a short time. This causes severe pain, and the fingers turn bluish, similar to when your hands are in ice-cold water. Imagine suffering this several times a day. A Cochrane review from a few years ago showed that PDE5 inhibitors reduced the frequency of Raynaud's attacks by an average of 3 episodes per week and the duration by 5 minutes per day. I mean, it's something considerable and worth keeping in mind if you suffer from Raynaud's, but for me, what's truly groundbreaking and new is coming up now. The thing is, they could have a neuroprotective effect. It's an emerging finding that really interests me. A 2024 meta-analysis with more than 8 million participants found a very encouraging result. Those who use PDE5 inhibitors long-term have a 47% lower risk of developing Alzheimer's. In the end, I always say the same thing. The brain is a bundle of blood vessels that includes neurons and glia. And keeping those blood vessels in good shape will ensure that neurons receive their nutrients and oxygen properly and eliminate their waste products more efficiently. Also, since they are vasodilators, they lower blood pressure. You know that one of the worst cardiovascular risk factors is high blood pressure. Tadalafil, by reducing arterial stiffness and increasing vasodilation, relaxes your vessels and lowers your blood pressure. This in turn leads to, watch out, one of its side effects that we'll see next. But before that, could Tadalafil improve your metabolism and help you lose more fat? This is also pretty crazy, and it seems that yes, it could. A 2025 meta-analysis of 13 clinical trials showed that PDE5 inhibitors, long half-life ones, like the one we're talking about, reduce glycated hemoglobin by 0.4%, while short half-life ones don't show this effect. This reduction, mind you, is comparable to some oral anti-diabetics that we use in daily practice. Also, look, there are even more interesting and crazy things. Although this was an isolated finding, in this study, daily 5-mega Tadala increased lean mass in non-obese men, possibly by improving the testosterone to estradiol ratio, insulin secretion, and enhancing endothelial function. In addition, an in vitro sub-study was conducted on muscle cells that showed something interesting. Those who took the drug had higher expression of androgen receptors in the muscle. As you can see, it has a tremendously interesting pleiotropic effect. We could say that it is a very, very good drug. But be careful, because every drug has side effects, and I'm going to mention them to you. The first one for me is something I would call psychological dependence. PDE5 inhibitors do not cause physical dependence. You won't experience withdrawal syndrome or physical dependence. But they can cause psychological dependence. Why? Let's see. Put yourself in the place of a man who feels anxious about sexual performance and planning for it. He takes the medication, and this aspect improves a lot. Well, it's common to find that afterwards, in a certain type of man, when he doesn't take the medication or doesn't have it for whatever reason, his level of sexual confidence without the pill can become very low. And in this profile, they end up not wanting to have sex without using it. Therefore, they become psychologically dependent on the drug. But be careful, the opposite case can also happen. People who regain their sexual confidence after using these medications, precisely by using it at low doses, 5 milligrams daily, that anxiety about planning sexual activity is eliminated. Because these medications are usually taken when you know you're going to have, or there's a high chance you'll have sexual activity, since they last about 36 to 48 hours. Is that clear? In fact, some people call it the weekend pill. Another very clear side effect is low blood pressure. Now, in people with cardiovascular and metabolic risk who usually have high blood pressure, this is not a problem. But in healthy people who have normal or even low blood pressure, or in those who are already taking one or more antihypertensive medications, it can be a problem, especially because of the risk of falls and fainting. And another precaution, be careful with Tadalafil and using saunas. It will lower your blood pressure even more. Headache and facial flushing are two of the most common side effects of these drugs, but very few people actually stop taking them for this reason, because they're usually not very intense. And one important contraindication, their use is completely contraindicated in patients who take nitrates due to the risk of severe hypotension. And importantly, this also applies to nitrate supplements, and that is less well known. Be very careful, athletes, because many athletes take either nitrate supplements or beet juice and other sources of nitrates. These will interact with Tadalafil. It will cause severe headaches, lower blood pressure, and reduce physical performance. So Tadalafil could be an anti-aging molecule, it could be considered an anti-aging drug, or a geroprotector. Unfortunately, the use of PDE5 inhibitors beyond treating erectile dysfunction or LOTS is not an indication approved by regulatory agencies. Therefore, any professional using it for this purpose must prescribe it off-label or prescribe it outside official indications. It goes without saying that you should never, ever self-medicate at your own risk, no matter how much information you see on the internet. Even though it is a drug that is generally well tolerated and has few side effects, it is still a medication. Look, most of the long-term benefits mentioned in the video are achieved with low doses, just 5 mg a day, which is the dose used in many of the studies I mentioned in the video. So please, if you have experience and want to share your case, as long as it was prescribed by a doctor and done properly, you are more than welcome to do so, and it will help all of us. Tadalafil is much more than just a pill for erections. It is a systemic vasodilator with documented effects on the heart, blood vessels, the prostate, and possibly the brain, kidneys, and metabolism. However, it is not a supplement, it is a medication with important contraindications, especially regarding nitrates. If you think you could benefit from its effects, talk to your doctor about whether you think it might be right for you. Now I'll go. I hope this video was helpful. Sending you a hug, and thanks for subscribing to the channel. See you in the next video. Let's keep empowering.